Every month, millions of women experience a complex, invisible rhythm inside their bodies. A cycle so finely tuned it can signal everything from the best time to conceive to subtle changes in mood and energy. But how much do we actually know about the phases of the menstrual cycle? Picture this: deep within the ovaries, an egg begins its journey, preparing for a potential life, while the uterine lining is simultaneously transformed into a lush, nutrient rich environment. Whether fertilization happens or not, this system keeps going, adjusting, adapting, and resetting for the next month. And all of this happens without us even being aware of the intricate changes taking place. In this video, we're going to break down each phase of the menstrual cycle, explain what happens in the body during each phase. Let's start with the definition. What is the menstrual cycle? The menstrual cycle is a monthly series of changes that occur in the female body to prepare for the possibility of pregnancy. On average, the cycle lasts about 28 days, but it can range anywhere from 21 to 35 days. The cycle can be broken down into four key phases. 1. Menstrual phase. 2. Follicular phase. 3. Ovulation. 4. Luteal phase. Each phase is driven by hormones and plays a crucial role in reproductive health. Let's go through each phase in detail to see what happens inside the body. Phase 1. The menstrual phase. It starts on days 1, 5. The menstrual phase is what most people think of when they hear the term menstrual cycle. This is when menstruation occurs, the shedding of the endometrial lining of the uterus, also known as your period. What's happening in the body? The uterus sheds its thickened lining because pregnancy didn't occur. Blood, tissue, and mucus are expelled through the vagina. This phase usually lasts about 3-7 days, but it varies from person to person. Common symptoms include cramps, bloating, lower back pain, mood swings, and fatigue. Phase 2. The follicular phase. It starts on days 114. The follicular phase overlaps with the menstrual phase, but lasts longer, starting on the first day of your period and continuing until ovulation. What's happening in the body? The pituitary gland in the brain releases follicle stimulating hormone FS. FS shit stimulates the ovaries to produce follicles, each containing an immature egg. As the follicles grow, they release estrogen, which helps thicken the uterine lining, known as endometrium, and preparing it for a potential pregnancy. One follicle becomes dominant, while the others shrink away. The dominant follicle will release a mature egg. Phase 3. Ovulation. It starts at around day 14. The next big event is ovulation. This is when the mature egg is released from the dominant follicle in the ovary and travels down the fallopian tube. Ovulation typically occurs in the middle of your cycle, around day 14 of a 28-day cycle, but this can vary. What's happening in the body? Luteinizing hormone LH surges, causing the follicle to release a mature egg. The egg travels through the fallopian tube, where it may meet sperm and become fertilized. This is the most fertile time in the cycle. Signs of ovulation. 1. Change in cervical mucus. During ovulation, cervical mucus becomes thin, clear, and stretchy, like raw egg whites, making it easier for sperm to reach the egg. 2. Slight temperature increase. Basal body temperature, your body's resting temperature, may rise slightly after ovulation. 3. Mild cramps or discomfort. Some people experience mild pain or discomfort on one side of the abdomen, known as Mittelschmerz. Phase 4. The luteal phase. It starts on days 15. The final phase of the menstrual cycle is the luteal phase, which occurs after ovulation and lasts until the start of your next period. What's happening in the body? After releasing the egg, the empty follicle becomes the corpus luteum, which produces progesterone. Progesterone maintains the thickened uterine lining, preparing it to support a fertilized egg. If the egg is fertilized and implants in the uterus, the body will produce HCG. Did you know that HCG is the hormone detected by pregnancy tests? If pregnancy doesn't occur, the corpus luteum breaks down, progesterone levels drop, and the endometrium sheds, starting the cycle all over again. Common symptoms of the luteal phase, premenstrual syndrome PMS. Many people experience physical and emotional symptoms like bloating, breast tenderness, mood swings, and fatigue during this phase. Acne or skin changes. Hormonal changes can cause breakouts or other skin changes. This marks the end of the menstrual cycle. Question of the day. What is the name of the first phase of the menstrual cycle? Only a genius can answer this in the comments below. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain, and eyes, visit my channel to view my other videos.